What is the premembrane pressure, limit typically set to during the priming check? A. 100 mm of mercury. B. 300 to 400 mm of mercury. C. 750 mm of mercury. D. 50 mm of mercury. Answer: B. 300 to 400 mm of mercury. Explanation: while the oxygenator can often handle higher pressures, most protocols set a safety limit around 300 to 400 mm of mercury. During priming, if pressures exceed this, it may indicate a forgotten clamp or a blockage in the oxygenator fibers. Which of the following is the most reliable way to detect microbubbles in a primed circuit? A. Inspection with a flashlight against the tubing. B. Using an ultrasonic bubble detector sensor. C. Monitoring for a drop in pump RPM. D. Checking the patient's SpO2. Answer: B. Using an ultrasonic bubble detector sensor. Explanation: ultrasonic bubble detectors can hear microbubbles that are too small for the human eye to see. These sensors are tested during the wet prime phase to ensure they will trigger an automatic pump stop if error is detected. Why is positive pressure maintained in the circuit during a CO2 flush? A. To prevent room air from leaking back into the circuit. B. To speed up the pump. C. To warm the circuit. D. To test the battery backup. Answer: A. To prevent room air from leaking back into the circuit. Explanation: by maintaining a gentle positive flow of CO2, you ensure that the entire internal volume of the circuit is occupied by CO2. If the pressure is neutral or negative, room air, nitrogen, can seep in through open stopcocks, defeating the purpose of the flush. In a roller pump system, often used in pediatrics, what is the occlusion test performed during assembly? A. Checking if the tubing is purple. B. Adjusting the rollers so they just barely stop the flow of fluid against gravity. C. Ensuring the pump can spin at 10,000 revolutions per minute. D. Testing the battery life. Answer: B. Adjusting the rollers so they just barely stop the flow of fluid against gravity. Explanation: unlike centrifugal pumps, roller pumps are occlusive. If they are over-occluded, they crush the tubing and cause hemolysis. If under-occluded, they allow backflow. The test involves holding a column of fluid and ensuring it drops very slowly or not at all when the pump is stationary. What is the primary risk of fast priming, running the pump at high speeds immediately? A. It makes the specialist dizzy. B. It causes gaseous cavitation, creating more bubbles than it removes. C. It breaks the pump blades. D. It makes the saline turn into ice. Answer: B. It causes gaseous cavitation, creating more bubbles than it removes. Explanation: high-speed rotation in a dry or partially filled pump head creates a localized vacuum, negative pressure. This can pull dissolved gases out of the priming fluid, creating a fizzing effect that introduces millions of microbubbles into the circuit. During assembly, the heat exchanger water lines should be connected and run. A. Only after the patient is connected. B. During the liquid prime to ensure there is no internal to external leak. C. Only if the patient has a fever. D. Before the CO2 flush. Answer: B. During the liquid prime to ensure there is no internal to external leak. Explanation: you must run the heater cooler during the wet prime phase. This confirms that the water jacket is intact and that no water is crossing over into the blood/saline path, which would cause a catastrophic electrolyte shift and hemolysis. What is the shunt or recirculation line in a neonatal circuit often used for during priming? A. To add medications without stopping the pump. B. To allow the circuit to be blood primed while the patient is still being cannulated. C. To bypass the oxygenator. D. To drain the circuit after use. Answer: B. To allow the circuit to be blood primed while the patient is still being cannulated. Explanation: in neonates, the circuit is often primed and then recirculated through a bridge or shunt. This allows the specialist to warm the blood, balance the pH, and check electrolytes in the circuit independently before the baby is connected. Why is normal saline, 0.9% NaCl, sometimes avoided as the final prime in long-term ECMO? A. It is too expensive. B. It can lead to hyperchloremic metabolic acidosis. C. It causes the pump to stop. D. It reacts with the CO2 flush. Answer, B. It can lead to hyperchloremic metabolic acidosis. Explanation: large volumes of normal saline contain a high chloride concentration, 154 milliequivalent/L. Balanced salt solutions like plasmolite or Ringer's lactate are often preferred to maintain a more physiological acid-base balance during the prime-to-patient transition. Which of the following must be de-aired with a syringe because the pump cannot clear it? A. The main arterial line. B. The pump head. C. The pigtail ports on the oxygenator. D. The bridge. Answer, C. The pigtail ports on the oxygenator. Explanation: pigtails and sampling ports are blind ends. Because there is no flow through them, air cannot be flushed out by the pump. These must be manually aspirated, sucked out, with a syringe until flashback of fluid is seen. When the specialist says they are walking the air, they are A. Taking a break. B. Manually manipulating the tubing to move a bubble from the venous to the arterial side for venting. C. Checking the wheels on the ECMO cart. D. Calibrating the oxygen sensor. Answer, B. Manually manipulating the tubing to move a bubble from the venous to the arterial side for venting. Explanation: walking the air is a manual technique where the specialist uses a clamp or their hands to tilt, tap, and move air bubbles through the circuit toward a designated vent port, usually on the oxygenator or a reservoir.